That's right. Ebru Prime Time News on this 25th day of April 2020 begins right now. Good evening and welcome aboard. My name is Kenneth. Kazungu. Our sign language interpreter for tonight is Joyce Werimo. We begin with measures in cushioning Kenyans from the first headache, where President Uhuru Kenyatta has signed into law the Tax Laws Amendment Bill of 2020. Now, this means that you are likely to have more money at the end of the month as the measures announced by the government to cushion Kenyans against the effect of the COVID-19 pandemic take effect.
The amendments include the raise in the threshold for turnover tax to between 1 million and 50 million shillings, so as to exclude small-scale traders from the presumptive tax. The new law further lowers turnover tax rate from 3 to 1%.
I would also like to express my heartfelt thanks to our National Assembly for rising to the challenge and seeing the merit to approve the tax measures that my administration had prepared. And I want to thank our legislators, and we will now ensure that employees have more of their earnings available for them to spend, and that also that we reduce the corporate tax burden as an incentive to business enterprises.
The amendment law, which mainly targets low-income earners, include 100% pay-as-you-earn tax relief for employees earning less than 24,000 shillings per month. Those earning above the new threshold will benefit from a pay tax reduction of between 30 and 25%. Similarly, the new act has revised corporation tax to 25%, while non-resident tax on dividends has been adjusted from 10 to 15%.
And I expect these measures to complement all the other measures that the government has and is taking to minimize the negative impact of the coronavirus on the economy and on the welfare of ordinary mwananchi.
The amendment law lowers the value-added tax rate from 16 to 14%, a move that is expected to lower the shelf prices of basic commodities. The new act has amended Section 38 of the Retirement Benefits Act of 1997 to allow access of retirement benefits for purposes of purchase of a residential house. This is aimed at increasing home ownership in the country, as envisaged in the housing pillar and the Big Four agenda. The bill, which was presented to the President for signature by National Assembly Speaker Justin Muturi, was passed by Parliament on Wednesday this week.
All right, staying with more on that presidential address, and the government says now it will not hesitate in imposing even more stiffer containment measures if need be, as Kenya works hard to flatten the COVID-19 curve. In his fifth address to the nation on the COVID-19 pandemic, President Kenyatta has extended both the dusk to dawn curfew and the cessation of movement into and out of COVID-19 hotspot counties for 21 more days in efforts to stop the virus, which has so far claimed the lives of 14 people in Kenya.
The coronavirus pandemic has continued ravaging the country, with the number of people now affected reaching 343 after 7 more people were confirmed positive. And on a day when eyes were on President Uhuru Kenyatta at a time when the containment measures were coming to an end, the president did not fail to act.
Cessation of movement into and out of the Nairobi metropolitan area and the counties of Kilifi, Kwale, and Mombasa that are currently in force shall be extended for a further containment period of 21 days.
The nationwide curfew was also extended for another 21 days.
Counties of Mandera, Kilifi, Kwale, and Mombasa have registered through their governors an increase in cases of infection and have reported this. And today we say that if this worrying trend does not reverse, more stringent measures will be taken in consultation with the respective county government.
However, the president said that the government was looking into de-escalating the measures once there was complete control over the COVID-19 virus.
Key to making these determinations is our progress with targeted mass testing, and we are working hard to overcome the greatly constrained global supplies of testing equipment in order for us to expand our capabilities nationwide.
President Uhuru Kenyatta also announced the launch of a national hygiene program to run for the next 30 days as a way of creating economic engagement for the youth.
For the next 30 days, we'll employ some 26,148 workers and eventually grow to over 100,000 young people across the country. This added to the already existing 108,000 vulnerable households.
Diana Rachel Mbogwa, Ebru TV.
To the economy now and measures to resuscitate it, and in a bid to resuscitate the economy that has received a hit due to the coronavirus pandemic, President Uhuru Kenyatta has announced a raft of measures, including the reopening of some restaurants in the next few days. At least 5,000 bars, entertainment spots and restaurants remain closed in Nairobi, with other 4,000 in Mombasa. Countrywide, over 20,000 joints remain shut, putting over 300,000 direct jobs on the edge, with at least 2 million dependents affected. The president, however, said only restaurants that meet highest levels of health regulations will be allowed to open. Health Cabinet Secretary Mutahi Kagwe is expected to announce and release protocols and criteria in coming days.
We shall allow a few restaurants and eateries in selected counties that show the highest levels of health regulation compliance and the ability to arrange for employee testing to undertake minimal operations while maintaining measures that mitigate against the spread of coronavirus. Cabinet Secretary of Health will in due course be announcing and release the protocols that we shall expect these facilities to abide by. Any report by the public or authorities that these establishments that we shall be reopening are not following the laid down measures and protocols will lead to their instant closure and indeed follow-up prosecutions.
Elsewhere, no Kenyan will be used as a guinea pig for coronavirus testing. Now, this is according to President Uhuru Kenyatta, who was addressing the nation earlier on today when reacting to claims, of course, by United Kingdom researchers that they were planning to use Kenya as a testing ground for the vaccine if the trials in the UK do not yield desired results. The president revealed that Kenya is conducting its own search for a vaccine, inasmuch as the search for remedy is a joint effort among international stakeholders.
Wengine ambao kwa interview walikuwa wanasema ya kwamba kuna utafiti ambao unaendelea hapa ambao will involve or Kenyans are involved in being used as guinea pigs for a vaccine test. Hakuna ukweli hata kidogo kwa haya madai. Ukweli ambapo uko ni ya kwamba institutions zetu kama KEMRI, kama Kenya Primate Research Center wanaungana pamoja na wengine kutafuta dawa, kutafuta vaccine ya hii ugonjwa. Na kama kutakuwa na kutafika wakati ambapo hawa wataalamu wetu watatuambia labda wameweza kudevelop vaccine to the point ambapo it shall require human trials, tutawaambia. Kwa hivyo, msidanganywe ya kwamba kuna lolote ambalo linaendelea kuhusu testing ya vaccines ambazo hatujui hapa kwetu Kenya.
Of course, we'll be coming back to that search for a vaccine and the hot and cold given the WHO perspective. But on to Kenya's second headache tonight, and over 100 families in Matangaine village in Juja sub-county woke up to flooded homesteads after an overnight downpour. The residents spent last night in the cold after the floods mopped their houses. They accused local leaders of neglecting their plight, saying they have been victims for flooding for 10 years every rainy season. That was not the only affected part of the capital, as a section of the Kasarani police station was submerged. In Machakos County, a section of a road in Mlolongo was rendered impassable due to the heavy downpour. President Uhuru Kenyatta has, however, called upon Kenyans to move to higher and safer grounds.
We mourn the 29 Kenyans who have lost their lives in Elgeyo Marakwet and West Pokot, and my administration continues to make every effort to support affected families and communities across the country. We continue to warn our fellow Kenyans that coming out of last year, where the rains were still very heavy and now are heavy once again, the risk of flooding, the risk of mudslides are increasing, and I would request and really plead with all Kenyans to follow the advice that is coming from the Ministry of Interior, that is coming from our meteorological people, that please let us move to higher ground, let us move from areas that have the potential of creating havoc, areas of Tana River, areas of Kitui, parts of Makueni, parts of Murang'a and Kiambu, Elgeyo Marakwet, areas like West Pokot, areas in Nyando, and other such areas prone to flooding. I do request that our citizens work with civil administration to ensure that we move to safer ground and remove ourselves from the risk of the danger that may be posed by these heavy rains. We, on our part, have mobilized the deployment of resources, including rescue personnel from our various security and humanitarian agencies, covering the Kenya Defense Forces, the National Police Service, the Ministry of Special Programs, amongst other agencies, to assist in these affected regions so as to provide emergency response, mitigation, as well as preventative action.
Staying with the matters to do with Elgeyo Marakwet County, and Uasin Gishu Senator Margaret Kamar is calling on the national government not to relent in the ongoing rescue mission in Chesagon area that was greatly affected by a landslide due to the ongoing heavy rains. At least 10 people died, with several others still missing. Kamar has, however, noted that the rubbles with ongoing rains, the mission might be difficult.
The heavy rains rained destruction in Chesagon area, with hundreds of the area residents being left homeless, counting losses. However, the worst part are those who are still missing and cannot be traced. The government is on the run to ensure that the rescue mission is still ongoing and food donations to the affected are delivered. The rescue mission, however, is not easy as it may seem, with that the Uasin Gishu Senator Margaret Kamar has now called upon the government not to relent. Speaking while delivering mask in Uasin Gishu County, Kamar stated that the ongoing rains and the rubbles was what was making the situation unbearable for the rescue mission. However, it will be unfair for the families who lost their loved ones not being able to trust their bodies.
When such a thing has happened, it is very unfortunate, because you can search to the point when there is nothing else to search, because debris is terrible. It will kill you and bury you. So even as much as they would like to have a better closure to this, it may be very, very difficult.
This comes in after the national government ended its rescue operations in Chesagon area. Further to that, Kamar has also called upon the expectant mothers to continue attending to their clinics when necessary, even with the fears of the spread of the COVID-19 pandemic. Milia Kisenya for Ebru TV.
All right, on to Kenya's third headache tonight, and President Uhuru Kenyatta is urging world leaders not to lose track of the collective war against other diseases that continue to cause human suffering around the world. Well, President Kenyatta says even as the world rolls out measures to contain the spread of the novel coronavirus, curbing the spread of other diseases is equally important. The president says malaria continues to ravage communities in Africa, with the sub-Saharan Africa accounting for 93% of the global malaria cases. On the same breath tonight, and Kenya stares at yet another pandemic, with experts now warning that malaria deaths in sub-Saharan Africa could double to 769,000 this year due to disruptions caused by the COVID-19 pandemic. The World Health Organization has listed Kenya among 27 sub-Saharan African countries, which account for 85% of the malaria cases and deaths in the region. And with Kenya joining the rest of the world in marking the World Malaria Day, Winnie Lubembe spoke to Dr. Alvin Juma on how to minimize disruptions in malaria prevention and treatment amid the COVID-19 pandemic.
All right, Dr. Alvin, thank you very much for joining us. My first question to you is, given the fragile health systems in the country, are we likely to see a scenario where we'll be overwhelmed given COVID-19 and then the doubling of the malaria cases and deaths in the country?
Thank you for hosting me. Yeah, right now, as you can see, everyone is focused on COVID. I mean, that's the sensible thing to do at the moment. But we shouldn't forget other diseases. As you said, this is usually malaria season for us because it's raining, there's floods and all that, and the cases are expected to go up. My hope is that we don't get overwhelmed, because malaria is easy to treat, to detect and to treat. So we go back to the basics where every person who comes in with a fever or malaise, the usual signs, we first, the easier thing to do to rule out is to rule out malaria before we start ruling out things like COVID. So I think we're in a relatively good position at the moment. The COVID cases are not that many, so we can still be in a position to manage both cases.
All right, and of course, given a little bit of similarity between COVID-19 and malaria, that's in terms of fever, do we see a scenario where some people will be scared to go to a hospital and get tested to ascertain whether it's malaria? Because again, we're seeing a number of people right now being scared to go to the hospital because they're scared. What if they're told they have COVID-19? So again, in the likelihood of again increasing cases of mortality rates in the country.
Yeah. Right now, in fact, we are seeing the the fear in the community. People are fearing to come to hospitals because no one wants to be branded as being COVID positive and all that. But that's said and done. We advise people to come to hospital if you feel unwell. The best thing is to come get checked out, and unless you're tested for either diseases, we won't know and we won't be treated well. Now, the good thing with malaria, we are quite familiar with it in the tropics. So most clinicians, myself included, if you come in with a fever, even without this COVID, the first thing we usually have to rule out is malaria, especially if you come or you visited certain hotspots in Kenya, like Nyanza, the coast, certain parts of eastern and northeastern.
All right, and of course, in terms of then pregnant women and children who, again, are more at risk of the same, what should be done then to, again, minimize the disruptions, and of course, in malaria prevention and treatment, which, again, will save life, at this time of COVID-19?
Yeah, that's such a good idea. Pregnant women and children under the age of 5, they contribute to the highest mortality when it comes to malaria. Now, the good thing, again, programs like, you have the HIV, PEPFAR, and AFIA Plus, which have been running in the country for some time, and they're well established. There's delivery of treated nets for free, especially in the hotspots. I remember at the time I was in Kilifi County in Mariakani, very robust program runs there. Everyone is given, to the last village, people are given treated nets. Malaria drugs are actually given for free. There's screening for all kids who come in with fever or feeling unwell, screening of pregnant women. So I don't think these well-established programs will be disrupted by this COVID current situation in the country. However, as you rightfully mentioned, fewer and fewer people are going out of hospital because of the curfews, limitations in movement. But I think NGOs are still, medical NGOs are still offering essential services in the grassroots, and I think that should not be a big deal. But overall, we should not put everything on the back burner and forget that people are still sick from other ailments. So we should not just focus on COVID, and forget that people are suffering from malaria, there's still tuberculosis, there's still HIV, there's still cancer, there's still hypertension, diabetes, etc.
All right. And then one last question, and I would want a very brief answer on the same, and that is on the cases of multi-drug resistant type of malaria. How are we doing in the country? Very, very briefly.
Yeah, so over the years, we've seen a lot of drugs, falling off the charts. Right now, there's a drug, everyone is talking about chloroquine and all that. There was a time when this drug was really, really abused for malaria treatment left, right, and center without prescriptions. But right now, the government has really done a good job in restricting treatment for malaria. It's test and treat. Don't assume you have malaria and then you're treated, because we are developing a lot of resistance. So the current drug regime that we have is actually very good for malaria. We use something called commonly known as AL in medical terms. It's very, very effective. We still have the chloroquines, very, very effective. But as outpatients, you normally use the artemether, lumefantrine medication. So it's test and treat so that you reduce resistance. Just like any other disease, if you give a large group of people medication that they don't need it, the disease might mutate and develop resistance. So when you need the medicine, it may not work effectively.
Okay. All right, because we see a lot of cases in the country where people self-diagnose. So again, from what you're saying, that is not the correct move, because again, increases, the cases of drug resistance. Thank you very much, Dr. Alvin Juma from the Karen Hospital. Really, really appreciate your time. And of course, there you have it. At the end of the day, the fact that we are pressing a lot of awareness right now as far as COVID-19 is concerned, Dr. Alvin is saying we should not forget other diseases, malaria being included. Back to you.
Right, thank you very much, Winnie Lubembe, for that interview on this World Malaria Day. It's very important not for us to forget malaria and other ailments in the wake of the COVID pandemic. Winnie, thank you for that. Now, the World Health Organization says it is well on course in the development of a vaccine for COVID-19, with 4 possible vaccines against the killer virus on trial. The vaccine white smoke comes amid uproar after British scientists suggested that they could start their vaccine trials in Kenya if tests in the UK do not get the expected results. The search for a remedy for the killer coronavirus has been giving scientists and doctors sleepless nights for a while now.
Since January, WHO has been working with thousands of researchers all over the world to accelerate and track vaccine development,
with the World Health Organization now hinting at a probable white smoke moment.
From developing animal models to clinical trial designs and everything in between. We have also developed diagnostics that are being used all over the world. And we're coordinating a global trial on the safety and efficacy of 4 therapeutics against COVID-19.
According to the Dr. Tedros Ghebreyesus-led body, a vaccine for COVID-19 is long overdue.
The world needs these tools, and it needs them fast.
But as the world unites to slay the COVID-19 dragon, the global efforts are seen to border on racist leanings.
But the team in Oxford have a really strong record going back 30 years, and they have developed a successful prototype vaccine against another type of coronavirus, MERS, which has done well in clinical trials.
This is because for the second time in under a month, scientists abroad suggest that trials for COVID-19 vaccines be done in Africa.
Now, if they don't get early, quick results in the UK, they're considering a trial in Kenya, where the epidemic of coronavirus may well be on the rise.
Fergus Walsh, the BBC medical correspondent, while speaking on the World Service about his assessment on how successful trial in the UK could be, made the comments that have attracted the backlash.
Kulikuwa wengine ambao kwa interview walikuwa wanasema ya kwamba kuna utafiti ambao unaendelea hapa ambao will involve or Kenyans were involved in being used as guinea pigs for a vaccine test.
With the Kenyan government now saying they are not aware of such an idea.
Ukweli ambapo uko ni ya kwamba institutions zetu kama KEMRI, kama Kenya Primate Research Center, wanaungana pamoja na wengine kutafuta dawa, kutafuta vaccine ya hii ugonjwa.
The global health body has also brought various nations together to form a multi-continental approach towards the equitable distribution of COVID-19 tools.
This is a landmark collaboration to accelerate the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics for COVID-19.
To the world of sports now, and Kenya football will enjoy yet another lifeline after former Harambee Stars coach Adela Mrushe agreed to wait a little longer for the settlement of a 109 million Kenya shillings debt owed to him by Football Kenya Federation. FIFA's extended deadline for the debt payment ended on Friday. FKF had requested for another grace period owing to the current coronavirus pandemic that has slowed down the economy globally. FIFA, in a letter to FKF, says that the case will be resubmitted to the disciplinary committee on May 18th for evaluation and final determination. Severe punishment awaits Kenya should the Algeria-born Belgian coach's arrears remain unpaid, most significantly Harambee Stars' expulsion from the 2022 World Cup qualifiers. That is Ebru Primetime News on this last Saturday of April 2020. On behalf of the super amazing team that has helped put this bulletin together, thank you so much, Kenneth, for watching. My name is Kenneth Kazungu. Our sign language interpreter for tonight is Joyce Warimo. Ensure that you stay home. Ensure you keep up to the government directives of washing your hands, observing social distancing, going home while it is only necessary. But above all and more, ensure that you take care of yourself and others. See you soon, and God bless.